Let us now go to visual diagnosis of the skin. Let us look at the Chinese pathology and diagnosis of eczema. The modern Chinese name for eczema is damp rash, clearly indicates the idea that dampness is always present in eczema. Remember, in eczema there is always dampness even if the skin is not oozing. Acute eczema is characterized by intense itching, vesicles and erythema, and swelling of the skin. Chronic eczema is characterized by itching, erythema, swelling of the skin, crusting, scaling, lichenification, excoriation, and erosion. It may be weeping or dry. Weeping eczema indicates the predominance of dampness, whereas dry eczema indicates the predominance of heat. However, it should be remembered that in eczema, there is always some dampness because there is always fluid-filled vesicles under the epidermis, which causes the swelling of the skin. When these vesicles come to the surface, the eczema weeps. Furthermore, in atopic dermatitis, the superficial stratum corneum of the skin is damaged, so the skin cannot hold moisture properly. This means that the skin becomes dry as a consequence rather than as a cause of the eczema. The main pattern seen in atopic eczema is damp heat, with one or the other factor predominant. If dampness predominates, the eczema is weeping. If heat predominates, the eczema is dry. And bear in mind, however, that in dry eczema, there is dampness too. In chronic eczema in adults, there is also damp heat, but the condition is also characterized by empty conditions, primarily in spleen deficiency and a blood deficiency, and dryness with blood failing to nourish the skin. Itching is caused by dampness or, in chronic cases, by the wind generated by the blood deficiency. Wind also plays a role in chronic eczema in combination with damp heat. Wind will manifest with the location of the rash on the upper part of the body with intense itching. In chronic eczema in adults, wind is also generated by the deficiency and dryness of the blood. If the skin oozes a yellow fluid, it indicates the prevalence of damp heat. If it oozes a clear fluid, it indicates dampness against a background of spleen deficiency. If the skin oozes after scratching, it also indicates dampness, whereas if it bleeds after scratching, it indicates blood heat. Thank you so much for your attention.